Hi, I'm Dr. Zina Berry from Dental Leadership Academy. I'm back today with a very good story. It felt so good today because I felt like I had a breakthrough with one of my clinical staff members, in particular a hygienist, and she's relatively new to the organization. So onboarding has been a project that we've been going forward with, but today's conversation was a game changer. I realized that some of the problems that a new hygienist will encounter is how to take over an perio program and how to come in and do it correctly and gain the confidence and trust of the patient so that you can carry forward. When they're new to the practice and they're new to hygiene in itself, that can be a real struggle bus for hygienists. So today I wanted to make sure that we had an alignment of conversation to understand how do we approach the patient together and how do we make sure that the patient is getting all the information they need in order to make a decision to go forward with treatment. So one of the things we talked about is what was causing her any problems in having that conversation with the patient. And she was like, well, Dr. Berry, when I'm seeing patients and I'm taking over from another hygienist, how do I approach it when they have a periodontal problem, but it hasn't really been identified or recorded in a way that the patient understands it? I said, well, we have to start with documentation, periodontal exam, x-rays, photos, all of that good stuff that we have to do for our patients. But what we're going to do a little differently is make sure you're explaining what you're seeing. And that's why you have, displays and props and other things to be able to have educational processes around you that you can grab and use it as an explanation. But patients really appreciate the fact that you take the time with them, show them their evidence of information. So let's talk about the x-rays. Let's talk about the pictures and what I see and some of the things that we see in your mouth that we need to remove because the disease is never going to go away unless we mechanically treat it, chemically treat it, or endogenously treat it. And so with that, she was like, yes, I agree, but sometimes a little hesitant to talk to the patient about it because they already had a hygienist that has been taking care of them for a long time. And so me new coming in, I just want to kind of go along. I says, no, you don't want to go along. You want to set yourself up for success with the patient, but they need to look at you as a licensed professional that you are. And I say, you own that territory. That's all yours. So all you have to do is to showcase what you know and teach them the things that they should know about their mouths and their condition and how we can correct it. It's not a struggle. It shouldn't be frightening. And the patient won't be intimidated by it because it's just a conversation and it's evidence-based dentistry. You can't go wrong with it. And she was like, you know what? You don't have to worry anymore. From now on, I'm going to make sure I give the foundation of information as to how it developed, where do we go next, and how do we treat it? So when you come in to do the diagnosing that I can't do, at least the patient has a fundamental understanding of what the condition is. And I was like, hallelujah, there you go. That's what I'm talking about. An alignment, a meeting of the minds. And guess what? It's no struggle. She doesn't feel the stress. She's able to educate her patient. And guess what happened today? All of her patients, not all of them were perio, all of her patients reappointed today. And with that, I saw her confidence rise up. So my equity with her is probably gone up a notch, but her equity with me has gone up tenfold. That's what we call an alignment. Process improvement is always the biggest room in the house that you can always improve upon. Take it from me. I'm Dr. Zina Berry of Dental Leadership Academy. I would love to be able to show you the way. Come back and see us.